Scotland's health boards have been ordered to meet tough new security measures for handling patient information following the document debacle at a Tayside hospital. North Tonight exclusively revealed how highly sensitive details on young children had been left behind when Strathmartine Hospital near Dundee was closed down. Well, Susan Nicholson joins us now live from the site. Susan.
Norman, it's nearly 5 months since I was inside the hospital. A lot has changed since then. For one thing, security has been improved. The broken door I climbed through has been boarded up, and the reams of paperwork we found inside have finally been recovered by NHS Tayside. Now, the hospital was used as a long-stay facility for patients, mainly children with severe learning disabilities, and it's information about them that was left behind. The images are grainy, but they capture the innocence and vulnerability of the children who were cared for at Strathmartine Hospital. The pictures, from the early 70s, were taken from a reel of film found lying on the hospital floor. Discarded, like documents containing sensitive patient information. This file contained details of a young girl born with fetal alcohol syndrome. We revealed the scandal in May, after NHS Tayside bosses turned a blind eye to repeated warnings from Karen Macaulay.
It took every single day of my life almost for 2 years to get them to fully understand the level and nature of the problem. Even daily phone calls or writing into them, it didn't matter what level I went to, nobody wanted to take it seriously at all.
But Karen's concerns had to be listened to when the Scottish Government ordered an investigation. The findings reveal a lack of project management, planning and leadership, poor communication and breaches of data protection rules. There are also serious concerns about why it took a TV news report to spur NHS Tayside into action when they'd known about the problem for years.
A number of people had responsibility in respect of different aspects of the closure and the clearance of Strathmartine Hospital. And one of the lessons we've learned is that we need to improve both the documentation around the project plan and also the communication. Talking specifically about individuals, I mean, you'll see from the report that one of the areas of concern is that a number of bags of documents which should have been taken away for shredding were actually put under the floorboards. Now, we've been unable to find out who was responsible for that. Had we been able to do that, clearly we would have taken particular action there. I think in respect of the overall process, we're looking on this as a way of improving our procedures for the future.
I think it's unbelievable that they're not going to consider disciplinary actions in matters that are as serious as this. That then basically means that we're leaving the same people to continue on running the hospital, and the same risks are possible again.
The documents are to be incinerated now the investigation has concluded, and sweeping changes are to be made to the way health records are handled.
So what are the changes, Susan?
Well, Norman, the expert group which conducted the investigation came up with 8 recommendations. These include new national protocols on how to deal with the closing down of sites like this, so there can't be any muddle or confusion about who's responsible for the safe disposal of patient records. There's also to be training for all NHS staff in data protection rules and information management. The recommendations have been accepted in full by the Health Secretary, Nicola Sturgeon.
Well, NHS Tayside will be expected to implement all of the recommendations. They've already given an undertaking to do that. And in implementing the recommendations, there will be improvements to both how disused hospital sites are managed by NHS boards and how patient records are protected. And that's what patients want to see.
So a clear determination there from the Health Secretary and from NHS Tayside that a situation like this cannot be allowed to happen again. I think what stands out in all of this is that when someone goes into the care of the NHS, let's face it, it's going to happen to all of us at some point in our lives. There's a huge element of trust involved. That extends way beyond the care and treatment we get from doctors and nurses to the safe guardianship of our personal information. Back to you, Norman.
Susan Nicholson, thank you.